Welcome back to The Health Hunt, a human, humble, and humorous exploration of how to level up your health. If you've been following along with us, you know that episodes 37 and 38 took you through Dan's ACDF spinal surgery journey from beginning to end. In episode 37, Dan shared the symptoms that it all started with, what his MRI revealed, the very different opinions he got from 3 neurosurgeons, and ultimately why he decided to move forward with ACDF surgery. And then in episode 38, we picked up with the surgery day and took you through what actually happened, from pre-op and anesthesia to waking up in a neck brace, going home, and navigating those first few weeks of recovery. After going through all of that, Dan realized there were a lot of practical questions about ACDF that we either didn't get into or that deserve a much deeper dive. So that's where we're going today. Think of this as Dan's ACDF FAQs, the questions you may not even know you should be asking before surgery. How should you prepare the body? Does protein matter? What about hydration? When should you start walking? What medications and supplements should you be asking about before surgery? Do you really need a recliner? What should you have waiting for you at home? Can you recover alone? And what is it actually like living and sleeping in a neck brace? This episode isn't about telling you what you should do. Every surgeon, hospital, and patient is different, and your own medical team's instructions always come first. Instead, Dan's sharing what he learned from his experience so that if you or someone you love is preparing for ACDF surgery, you may walk away knowing a few more questions to ask and a few more things to think about. And of course, the Health Hunt podcast is for informational and entertainment purposes only. We're not medical professionals, and nothing we share should be considered medical advice. Always consult your healthcare provider about your individual health and medical decisions. All right, Dan, let's get into these ACDF questions.
All right, ACDF, not ACDC. Thank you, Sandy. Great intro. The inspiration for this was all of the work that I had done prior to my surgery, being in a lot of chats, groups, hospital consultations. It's an aggregation and a through line of all of those things and questions that I had seen multiple times. So I'm hoping through this, I'm addressing a lot of what people are interested in and wanting to know. And then in the end, obviously there's ways to contact us. There's other things I know that I may not have included, but just to kind of cement, and this may be a little bit repetitious, before I get started, I wanted to further emphasize something that's really important. Every surgeon, every hospital, every medical center has its own pre-surgery and recovery protocols. I just had mentioned that I had mine, and part of that is integrated into these questions and FAQs. The information I'm sharing today is not meant to replace the instructions from your surgeon or your medical team. They are the sources of truth for you and your journey. My goal is to help you become a little bit more informed as a patient so you can have better conversations with your surgeon, oftentimes with your physician assistant who is going to be responding to a lot of the messaging, nurses, physical therapists, and so on. If something I discussed today differs from your surgeon's recommendations, always follow your surgeon's recommendation. I think from there, we can move on to jumping right into the FAQ. There's no particular intuitive order for this stuff. These are just questions that people have been asking. There's kind of a journey, but really it's just we're going to kind of do not rapid fire, but we're going to go through these questions as I'm addressing them in kind of popularity and importance to people throughout the various mediums that I had surfaced.
Okay. So this first section is about how to prepare your body for surgery. So the first question is, how much protein should I eat and why is this important?
So for me, the doctor had recommended 15 to 30 grams of protein per serving in the weeks leading up to surgery. Now, you're probably already getting protein in your diet. And some people who are very fit, are doing 1 gram of protein per pound or whatever. And so this is kind of nothing new for them. But if you're getting no protein, you really want to be getting the 15 to 30 grams, at least from the hospital I went to for my surgery, twice a day at the minimum. And so, that can come by way of chicken, by protein drinks. Protein helps support muscle preservation. It's very good for wound healing, supports your immune system, and the bone fusion process. So it's important. Now, having said that, having protein before you go in may seem kind of counterintuitive because you're thinking maybe I should have it after my surgery, which you should. Even more important.
Okay. So the next question, hydration. Does it matter?
Hydration absolutely matters. I broke it down 2 ways. There's the pre-surgery hydration and the post-surgery hydration. Basically, in the days leading up to your ACDF surgery, the goal isn't to drink excessive amounts of water. It's simply to avoid being dehydrated. Staying well hydrated supports normal body function and recovery. And hydration isn't just about water. It's about maintaining a healthy balance of electrolytes, sodium, potassium, magnesium, which all can come from your balanced diet. You're probably already doing this. Post-surgery, so after surgery, hydration is especially important because you'll have a sore throat or you're going to have difficulty swallowing with the ACDF surgery. And so you may actually be drinking less than usual. Take small, frequent sips and focus on maintaining normal fluid and electrolyte balance rather than, again, drinking separate amounts of plain water. Good hydration supports recovery and can help fatigue and constipation from pain medications.
Okay, so speaking of pain medications, let's talk about them. What is important to know about Percocet or things like oxycodone and acetaminophen?
Right. So this is something that is near and dear to me. I know people are familiar with Percocet in the world of pain medications and acetaminophen and so on and so forth. I had never taken Percocet. Maybe I had taken it randomly once, but Percocet can cause constipation, and it definitely caused me constipation within a day or two of taking it. And oxycodone, one of the ingredients in Percocet, slows the digestive tract. So other, common side effects are nausea, dizziness, and drowsiness, impaired reaction time. If you're taking an opioid after surgery, your medical team may recommend a laxative such as Miralax, along with good hydration and walking. But honestly, you're going to get constipated if you're taking this Percocet 1 to 2 days or more. So just have, another solution like a laxative or something in that regard available to you because you do want to stay right.
Okay, good to know. All right, so movement, and this is with respect to after the surgery. Should I keep walking?
Huge. Great question. Yes, walking is one of the most important things you can do after ACDF surgery. As a matter of fact, my doctor had recommended that I could be walking as soon as possible. So I was walking within 12 to 24 hours. I don't care if it's 1,000 steps, 5,000 steps if you're running a marathon. You need to be walking. Well, don't run a marathon. But walking improves circulation. It reduces the risk of blood clots. It prevents muscle loss and deconditioning. It maintains mobility and helps rebuild strength and endurance without placing significant stress on your healing neck in the future. Like, come on. You need to be walking.
Okay, good tip. So let's talk now about nicotine. Why is it such a big deal? And it's something we have to stay away from.
So this is pretty straight and clear. And honestly, walking is 1A and nicotine 1B. Nicotine might even be 1A. Nicotine, you should avoid at all costs. Now, I'm going to break this down before surgery and after surgery. Avoid nicotine before surgery. Nicotine reduces blood flow and oxygen and delivery to your tissues and can interfere with the body's ability to heal and build new bone. I mean, that's not good. After surgery, it's really important you stay nicotine free. The hardware stabilizes your spine, but the goal is for the new bone to grow across the surgical level and create a solid fusion. Nicotine can interfere with the process and is associated with a higher risk of, and again, this is a word that we need to look up. I don't really know what this, of pseudoarthrosis or failure of the bones to fuse. So I guess that's what pseudoarthrosis means. But nicotine prevents the success of bones fusing. This can contribute to persistent pain, hardware problems with the titanium and screws in your bones in your spine, prolonged recovery, and potentially having another surgery. No one wants that. You just went through a major operation. You got 2 vertebrae to become one. You don't want to give nicotine the opportunity to work against the healing process. So if you're a smoker, I know this is it's a tough one, but you really, post-surgery, but certainly after surgery, want to avoid nicotine. But talk to your surgeon about how long that could be if you get back to smoking. But it's certainly within the time frame after your surgery, you do want to stop using nicotine.
So now let's talk about medications and supplements. And these would be things that you were already taking before your surgery. So when and why should I stop a GLP-1 like tirzepatide, Zepbound, or Wegovy?
So we all know about GLP-1s like tirzepatide. They are critical to discuss with your surgeon and the anesthesia teams before ACDF surgery. They frankly should ask you about this or alert you to this. But as we all know, GLP-1s, they still stomach emptying. This means food can remain in your stomach much longer than expected. So even when you follow standard fasting instructions. So under general anesthesia, your normal protective reflexes are suppressed. So stomach contents could potentially come back up and enter your lungs, causing aspiration, a serious and potentially life-threatening complication. So As I know it and understand it, current guidance doesn't require everyone to stop GLP-1s, but some patients may need to hold them or take additional precautions. The key takeaway: tell your anesthesiologist you're taking a GLP-1 before your surgery and follow their instructions as to what they want you to do in regards to getting off of it completely, lowering the dose, or what have you.
It certainly sounds like a very important line of questioning. Now, what about omega-3s?
So omega-3s is also a topic of conversation for my surgical team. Fish oil and omega-3 supplements are often stopped before ACDF as a precaution because they make it harder for your blood to clot normally and can potentially increase bleeding. So that's enough right there. I mean, bleeding is particularly important to minimize in neck surgery because a collection of blood and swelling near the surgical area can potentially put pressure on your airway and become a serious emergency. So typically, 1 to 2 weeks before surgery, they want you off these things. That was what my surgical team had asked. But ask your doctor. But flag omega-3. Omega-3s are super healthy supplements, great for your brain, great for your heart, but not great for your ACDF surgery. So do talk to your surgical team. I just want to add one more thing more generally. My surgical team asked me to be off all supplements, no matter what it was, 5 days prior. That was just how they had come down. I'm not sure what the reason is for that, but I am taking a lot of supplements, and I figure, outside of them not being critical to my health, better safe than sorry. Just get off all of them so there's no type of issue.
But at the very least, you probably want to at least let them know what you're taking.
Totally agree.
So we talked about medication before, but if you're having the surgery, it's possible and likely that you're having pain, so you may be on an NSAID. So when and why should you stop all NSAIDs?
So I'm 5.5 weeks out of my surgery, and I'm still not taking any NSAIDs. I've replaced it with acetaminophen, Tylenol. So NSAIDs, these are common pain relievers: Advil, Motrin, Aleve. There are others. Before surgery, the concern is that some NSAIDs can make it harder for your blood to clot normal and increase the risk of bleeding. So your surgeon will likely have you stop taking these. After surgery, the concern changes. Inflammation is actually a part of how your body builds new bones, and prolonged or higher dose NSAID may interfere with the bone healing process needed for a successful fusion. That's why many spinal surgeons prefer Tylenol, as I mentioned, acetaminophen, for basic pain relief during recovery and, maybe for a longer time after that.
Okay, so let's get into a new topic, and this is basically preparing your home for when you come home after surgery. So the first consideration is, do I need a recliner and the bed wedge set?
So the answer to this is you don't need a recliner and bed wedge set. But I got a recliner, and I would say it was one of the most valuable tools to my recovery. I wore a neck brace for the first couple of weeks and found it really difficult to get comfortable or sleep in my regular bed. If you already have a motorized recliner, you're winning the game already. If not, consider renting one from a medical store near you for a few weeks. I especially recommend a 5-motor recliner because the different sections adjust independently and let you customize the position you're trying to get comfortable with. Another great option, and this is what the bed wedge set would be. If you're using a bed and you don't want a recliner, you don't have a recliner, the bed wedge set, you can get them on Amazon, is another great tool. I did not use it, but in chat groups and what I've heard from other people who have ACDF surgery, they have. So the answer is you don't need these things, but honestly, I would look into them. If you're going to be wearing a neck brace, it's very critical that you get some type of sleep, and both these options help.
Can you give us a list of items that will help you prepare your home for the ACDF recovery period?
Sure. So here's a list of some of the important things. And again, feel free to message me if there's other things I'm missing that you have questions about, and we'll see if I can help. So you want to remove tripping hazards. These are things as clear, loose rugs around your house. Are there cords that are extending and hanging out? Is there clutter between possibly your recovery area and your bathroom? These are important things to understand because you're going to be walking around. You might have a neck brace on, and the last thing you want to do is fall. I would also, if you can, kind of create a recovery station. Keep medications, water, charger, remotes, tissues, other things all in the same area so you know where to get them. I would move all of your essentials to waist and chest height. Again, this may be a lot and maybe kind of over dramatic, but reaching for something in the first couple of days that's at your eye level or your neck level is a lot easier than bending down for these things. So you maybe want to kind of survey your area and move essentials accordingly. As far as food goes, you can make meals ahead of time. You can arrange for food delivery, but generally speaking, it's liquids and soft food, applesauce, yogurts, protein drinks, water, so on and so forth. You're probably not going to be having a steak dinner and a, Caesar salad with croutons within the first couple days after your post ACDF. Set up your sleep space. So my sleep space was the 5-motor recliner, as I mentioned. Everything that I needed with the blanket, a pillow, and things associated with sleeping that I need, CPAP too, near there. You can have the wedge set in your bed. If you don't want the wedge set, you could even just do a lot of pillows, but make sure you test that because that still may not be comfortable. Set up your sleep space. Prepare the bathroom. Again, I mentioned this, having, have everything at your neck or eye level. Have all your shampoos, shaving materials, anything bathroom related, all in one area so you can reach them. Again, this is when you start showering, which should be 48 to 72 hours after your surgery. A non-slip mat, if you don't already have one, could be useful. A night light if you wake up at night and need to go to the bathroom for whatever reason. Could this be overkill? Sure, but these are things you need to be thinking. And this is a big one, but plan it around lifting restrictions. Don't be getting groceries, 24 hours after your ACDF surgery. Don't be taking the laundry bag or doing laundry, taking the garbage out. One thing that people may not think of is pets. You may want to have someone take care of your pet, or if you're living alone, or if you're having help, someone, walk the dog, because bending down for your dog can be really, really painful. And so we love our pets, but in these first, couple days or weeks, you really have to take care of yourself. And obviously anything heavy. And I just mentioned this and I'll drive it home. Have help available, especially if you're living alone. I live alone. I had my sister and my mother come down, and they were invaluable to me for odds and ends and different things. And so make sure you have some people around. Bottom line is set up as much as possible before surgery.
Okay, so now sort of in the same vein as what we're talking about, in this preparation stage, what products would be worth having already purchased before your ACDF surgery?
So I mentioned a few of these already. I'm going to kind of rapid fire these. If you have any questions, again, you can reach out to me. Reusable ice packs. They're great. Have 2 of 3 of them so you can rotate from your neck and shoulder soreness. Extra long phone charger. I had a 10-foot cord I used. Obviously people may have power packs or anything. I'm still kind of living in 2018 with my long 10-foot cord charger. But that was invaluable to me as I needed to be moving or I need to be reaching, and sometimes the cords aren't as close or as convenient to where you're sitting. Slip-on shoes. I bought a pair of these for the hospital and then for home. They're great. There's various kinds of them. You can find them on Amazon. Easy to hold water bottle. You mentioned the hydration, so have a water bottle that's easy to hold. Long bendable straws. This is one I thought of as I wanted my Diet Cokes for my Coke Zeros, and I couldn't bend down to actually get them into my mouth. So I had these long straws that were bendies, and it made you can put in any drink, obviously, but that was my experience, and that was kind of like an invaluable little hack. Pill organizer. Maybe you're using that already. Not critical, but thought I'd mention it. Grabber or reacher tool if you're going into high parts of your cabinetry or whatever. This is also mentioned within pre-surgery ops consultations. You may not need one. If you have help, you're not going to really need one. But something to think about. Wedge set I mentioned. The recliner I mentioned. Shower chair, non-slip mat. I mentioned this already. Button down or zip up shirt. So these are great. Honestly, this is a 1A tier 1, button up so that you can easily take your shirts off and not have to pull them over your brace or your head in the first couple of days. You can get some of these very cheap on Amazon. There's a whole list of retailers that offer these type of things. You don't need to buy all of this. There may be things I'm missing here, but these all can make your life a little bit easier post-surgery.
Great. So we touched on this, but I think it's important enough that we should have its own section and question. Can I recover alone?
So I could definitely not recover alone. So I guess the answer is it depends. So I'm going to list a couple of, these require no explanation, but I'll list a couple things here that you should be thinking about. So have someone with you initially, at least the first 24 to 48 hours. You may already be living with a husband and family, and so or a spouse and a family. And so this is not an issue. But for me, I needed to arrange these things. Again, do not underestimate the first few days You have anesthesia, pain medications, fatigue, and neck brace. I mean, there's a lot of things that are happening, and so you really need to have someone with you. Planned transportation. There are some states that allow you, or doctors that allow you to drive right away, but if you're wearing a neck brace, it's not advisable. I'm speaking from firsthand. I would have loved to have driven. I literally have no range of motion in my neck, and I couldn't. So you may be different, but just think about that and plan accordingly. There's also Uber and Lyft and other things that you could use should you not have someone being able to drive you. Get help with lifting. Again, we talked about this. No heavy lifting and no reaching far above your head. Maybe have a backup person. Even if you're recovering alone, have someone nearby who you can check in, bring supplies, or come over if you need help. So I'm driving this point home of having support for the first 24, 48, 72 hours after your surgery.
Can you share everything people should know about the incision and wound care after surgery?
Yeah, so this is my experience, and this is the knowledge base that I had through my pre-surgery call and just seeing some people in chats talking about incisions. The incision is usually small and placed horizontally on the front side of your neck. That's, for our obviously ACDFs go through the neck. It may look initially swollen, red, bruised, or slightly raised. Depending on your surgeon, it may be closed with dissolvable stitches, which are under the skin. It could have surgical glue, which mine did, steri strips, or a combination of those. I will mention just because it's important, but also as it relates to the incision, showering is often allowed within a few days following your surgery. But again, follow your surgeon's specific instructions. Let the incision heal on its own. Don't pick at the surgical glue. I certainly did not. And don't apply creams, no ointments, peroxide, or scar products until your surgeon says it's okay. Once the incision is completely closed and healed, scar care may include silicone gel sheets, which are pretty common. You can buy them anywhere. And of course, you want to have sun protection. You don't want the sun on your incision.
So let's talk about the neck brace. Will I need one?
So I was surprised to learn that some surgeons require a neck brace and some don't. So you will find out from the surgeon that you are using whether they require one for a week or two or not at all. So again, not everyone needs a neck brace. There are different versions of the neck brace, and oftentimes these versions of the neck brace, as I mentioned in a prior podcast, are given because it's what the surgeon was trained on. It's what the hospital is contracted with. I had the Miami J, and there's also the Aspen one. I think there's a Nashville one. I'm not even sure how they name these things, but they all kind of do the same thing. So again, it may vary how long you have the neck brace on, but the brace provides support. It limits excessive neck movement and can provide additional stability and protection during early recovery. For me, I'm really happy I had a brace. It's a feeling of comfort that your neck is not moving. I know it's annoying, but honestly, I'm glad I had one on. But again, follow your surgeon's instructions. They know best.
So if your surgeon has recommended a neck brace, can you talk to us about what it's like living with that neck brace?
Yeah. So the 2 weeks that I had my neck brace on, I will just say the sleeping was a major adjustment, maybe 2 hours a night. You're just not going to get sleep. If you do get a lot of sleep on your neck brace, I want to hear from you and know how you did it. And it's no fair. You can't be taking drugs. You can take drugs if your surgeon allows you, but that's cheating. I did not take any drugs. So proper fit matters. The neck brace comes in two different parts, at least the Miami J did, and you can tighten it based on Velcro straps. So you want to find the comfort zone there. There's pads on these neck braces. There's 3 pads on each part. You want to keep these pads clean. You want to clean them every day or 2 at most, soap and water, or however the instructions are that your surgeon gives you, but keep them clean. They're obviously rubbing against your neck and you're having them on for 2 weeks. It's important that you don't get any irritations and so on and so forth. So check your skin. Look for redness, rubbing areas, or pressure areas. Eating can feel awkward. Smaller bites, softer foods, and the bendy straws I mentioned really do help. But it does get easier. You do kind of get used to it. And just when you're actually really used to it or somewhat used to it, you go to your post-op appointment and you'll take it off.
So as you're preparing for surgery, most people probably have to consider taking time off of work. So how do they determine what that looks like? And after the surgery, when do they feel like they're comfortable to return to work?
So returning to work, as I understand and in my readings, is completely subjective. It's basically depending on what you do. Someone working from a laptop at home is very different from a nurse moving patients or a construction worker lifting heavy weights or someone who drives for a living. So I often find that if you're in the readings, again, I often found that if people are, working desk jobs, working remote at a computer, they're returning from their anecdotes as early as a week, some earlier. And then obviously, if you have manual labor or you have to report somewhere to be in office, it appears that is week, 2 weeks beyond. But again, this is subjective. It could take up to 6 to 12 weeks to return to work. It really depends. I'm not saying it will, but you want to monitor this. You want to see how you feel. And again, you want to be in touch with your surgeon's physician's assistant or whatever team is available to you to understand how that might look for your healing process.
So with respect to the recovery period, talk to us about physical therapy after surgery.
So physical therapy is what I'm actually doing now on physical therapy number 4 post-surgery. So it's obviously really fresh. But again, let's just make sure we all understand. You should be walking as soon as you can. This is the most important thing for all the reasons I had mentioned. Physical therapy will be given to you by your surgeon's office as soon as, mine was a month or whenever they, in their judgment, think that you need to be at therapy. But yes, it's an important part of the process. You need to strengthen neck muscles, maybe your core, abdomen, your back, all of these things, flexibility, mobility. You want to go to a good physical therapist. Oftentimes, it is recommended to go to the physical therapy entity associated with your hospital because they have direct connection to the surgeon's office. And so the notes are shared. There's a lot of visibility and it's not fragmented. If you go to like a third-party physical therapist. So something to think about. But yes, physical therapy is an important part of the process moving forward. And when you start that is really based on your body and your surgeon's office.
Okay, so in terms of getting back to your regular life, when is it reasonably safe to drive?
So I mentioned this before, and just drive the point home here. It's safe to drive once your surgeon clears you, especially if you're taking medications. You do not want to be driving. So once you're off narcotic medications, then driving is a consideration. If you don't have a neck brace on anymore and you're 2 to 3 weeks or whatever the timeline for your neck brace being off, then it might be safe to drive as well. There isn't one universal in 2 weeks or 4-week rule. Your surgeon's protocol matters here. You need sufficient neck movement to see traffic and blind spots. And you shouldn't drive, again, on medications if you're dizzy, if you're weak. And the cervical collar will totally interfere with your blind spots. So, and again, state medical driving laws vary. They're not really an issue here, but for most ACDF patients, the practical issue is whether you're medically and functionally safe to drive, not any ACDF specific state law. So what I've just covered are the top of mind critical FAQs. I've used some of my experiences, some of the experiences I've read and talking to other doctors and other individuals. And I hope this is helpful for people to start thinking about and asking questions, but again, ultimately listening to your doctor. If you have further questions, either about the things I've talked about, or you have other questions that I can be a resource on, you can certainly reach out to us at info@thehealthhub.com. And I will certainly respond. Happy to have further conversations. I'm passionate about helping other people and want to see if I can fill in any of the gaps for you, or at least put thought bubbles in your head so that you can reach out to your doctor's office and ask the best questions. So again, thank you very much. I hope this was helpful.
Hopefully this episode answered some of the practical ACDF questions that don't always come up until you're suddenly the person getting ready for surgery. And if you found us through this episode because you're preparing for ACDF yourself, make sure to go back and listen to episodes 37 and 38. These 2 episodes tell Dan's full story, from the symptoms and the 3 neurosurgical opinions that led his decision through surgery day and the first few weeks of recovery. And remember, Dan's experience is just that, his experience. Your surgery, your recovery, and your surgeon's protocols may be completely different, so always follow the guidance of your own medical team. But if there's one thing we hope you take away from this entire series, it's this: ask questions. Ask a lot of them. Understand your options. Get another opinion when you need one. And don't be afraid to advocate for yourself when it comes down to your own health. If you know someone who's considering ACDF, preparing for cervical spine surgery, or helping someone through recovery, please share this episode and episodes 37 and 38 with them. sometimes just knowing what questions to ask can make a pretty overwhelming experience feel a little more manageable. And if you've had ACDF yourself, we want to hear from you. What did you wish you had known before surgery? What made your recovery easier? Or is there an ACDF question Dan didn't answer today? As mentioned, you can reach out to us through our website, social media, or info@thehealthhunt.com. And before you go, make sure to follow The Health Hunt wherever you listen to podcasts. And if you're enjoying the show, leave us a rating or review. Every follow, review, and share helps more people find us. Until next time, keep asking questions, keep advocating for yourself, and keep hunting for better health.